Missouri is in the midst of distributing the COVID-19 vaccine, as we all know. Can you tell us the priorities of DHSS in this distribution?
Yeah, Megan, thank you so much, and thanks for what you're doing communicating. We think it's just so vital to what we're trying to do. Our priority is always the most vulnerable. And I define that if you had two people, and we know by either demographic or risk factors that the person to the left was more likely to get sick from getting COVID, as opposed to the person on the other side, that's the person that we want to make sure gets the vaccine. And in Missouri, that's people over 65, and that's about 1 million people, and then about another 1 million people who have what we call comorbidities: heart disease, cancer, pregnancy, Down syndrome, and type 2 diabetes. And so that is very much our prioritization. Now, in the first tier one, phase one, we very much were focused on long-term care facilities and residents, because we knew that that's where 40% of our mortality was coming from, even though they only made up 4% of the cases. So we've moved through that phase. We also were very conscious about our healthcare workers who take care of those people, because they're like the pilots of the plane. If the pilots of the plane get sick, then everybody else behind them is in big trouble. And so now we're into Tier 1B, or Phase 1B, and Tier 1 is again those other healthcare workers, first responders, people who are vital to trying to keep people, EMT, safe. And then Tier 2, which again is people over 65 and older, and the 1 million with comorbidities. So that's where we are.
All right. So we also recently announced our max vaccination events in partnership with the National Guard and local health departments. And we've announced the high throughput partnerships with our hospitals and healthcare providers. Can you give us a little more information about each type of those events and then how each of those supports our priorities?
Yeah. So as we try to get the vaccine out as efficiently as we can, and remember, we never touch the vaccine. We don't have a big warehouse where we ship it. We literally just say where it's to go. We're kind of like a coach. We just call the plays. We don't actually do the plays as we go into Super Bowl on Sunday. And so what we looked at was what would be the best way, who could get vaccines in arms quickest. And that turned out to be our large healthcare systems that have already done it. They started on December 14th with the Pfizer. And our National Guard, which literally in one day can go in and do 2,000 right then, right there. And we can move them all around in all 9 regions of the state. So that was the thought behind our strategy. I think the other thing that guided that was that what the federal government had heard was that it would be incredibly helpful to these high throughputs, the National Guard or these big healthcare systems, was to know they were going to have vaccine in 2 to 3 weeks so they could schedule these clinics. And so they have committed to us that, yes, we will tell you for sure you will get first doses in 3 weeks. And so that's incredibly helpful to the Barnes-Jewish hospitals and the researchers and the Trumans and the St. Luke's to say, okay, show up in 2 weeks, we know vaccine's coming, and we're going to do 5,000 in 5 days.
All right. So can you give us a bit of an overview of how DHSS determines which providers get the vaccines?
Yeah, so right now we've allotted 53% to our healthcare systems and asked them to make sure they're reaching out into the community. And they know their communities well, like Truman and Research and Cox and Mercy down in Springfield. They know where their vulnerable people are. So that's 53%. Then another 23% is going to the Missouri National Guard. They're doing 9 sites in 9 regions every week. And they're going to our more rural areas where there might not be as many pharmacies or big hospitals. And so we know how many people have been vaccinated in each county. We know where our vulnerable areas are. We know where there's high disease of heart disease or cancer. And so we're trying to map those up. And then we also just look at geographic. We put every day on our dashboard, moststopscovid.com, that you can see how many people have been vaccinated in each county. And so we're concerned about that. No matter where you live in Missouri, we want you to be able to get a vaccine.
All right. So we've seen the news reports about Missouri being ranked 49th or 50th in the nation for vaccine distribution. Can you provide some information about how the New York Times came to that conclusion and how our teams are addressing that report and our distribution process?
Yeah, we think rankings are important. We understand that they can be kind of volatile. We're 43rd today around the country. I think we were 48th yesterday. We've been 9th, we've been 16th, we've been, I think, 38th. So a couple issues there. One is we gave a large dose of our vaccine to the federal government to vaccinate our long-term care facilities, and they've now had to return almost 80,000 doses of that. So that got counted against us right off the bat. The other thing is that there's a little bit of lag between the data reporting from other people in Missouri, so we're working with the CDC to account for that. And then finally, you have to remember that at the end of the day, wherever we rank, it's dependent on the vaccinators getting the vaccine into people. The state of Missouri never has the vaccine, so whether we're first or 50th, it's not because we're not distributing it, it's because the vaccinators either A, haven't gotten it in the arms fast enough, or they're not reporting it. And we know where every vaccine is, and we think it's more the latter. They're not reporting. So as part of the governor's initiative this week, we've said you have to vaccinate within 7 days and report as you're doing it. And so between the Missouri National Guard and these large healthcare systems, that's 73%. We think that universe will report very quickly, and that will change our rankings.